All right, in the world of biohacking and bodybuilding, there is this one compound that gets whispered about like it's some kind of magic potion. It's got this incredible nickname, the Wolverine peptide, and its name is BPC-157. The promise? Near superhuman healing. Today, we are going to put that promise right under the microscope. And just so we're all on the same page, this is all about the science, okay? This is not medical advice.
I mean, the hype around this stuff is it's off the charts. And it's not just about a torn muscle anymore. Dr. Alex Tatum puts it perfectly. The internet has basically decided that BPC-157 can fix everything from a completely shredded ACL to, maybe even a broken heart. Now, that is a powerful, almost irresistible idea for anyone out there trying to push their body to the absolute limit.
So that brings us to our mission today. We are going to cut through all the noise, all the anecdotes, all the bro science, and try to find the real signal. What does the actual peer-reviewed, published data have to say about this so-called Wolverine peptide?
Okay, so first things first, what is this stuff? To really get a handle on BPC-157, you have to know where it comes from. And believe me, it starts in a place you would never ever expect, the human stomach.
So its full name is Body Protection Compound 157, and that name is a huge clue. It's called that because it's a synthetic piece, a chain of 15 amino acids, from a much larger protein that's found naturally in our own gastric juice. You heard that right. The Wolverine peptide is derived from a substance that protects our stomach. Kind of weird, right?
And the story behind it is actually pretty fascinating. Back in the 90s, some researchers in Croatia were trying to solve a really basic biological puzzle. Why doesn't our super acidic stomach just digest itself? Well, they found a protein that acts like a bodyguard, a body protection compound. From there, they created a small, stable piece of it, and voila, the molecule we now know as BPC-157 was born.
Which, of course, leads to the million-dollar question. How on earth does a protein from your stomach supposedly give you Wolverine-like healing powers in your shoulder or your knee? What's the theory here? How's it supposed to work?
You know, the best analogy I've heard is this. Think of an injury as a construction site. BPC-157 isn't the bricks and mortar. It's the foreman. It doesn't do the heavy lifting itself. It organizes the entire crew, points them where to go, and makes sure the whole repair process happens faster and way more efficiently.
And here's the blueprint for how that foreman gets the job done. The science suggests it's a three-pronged attack. First, it boosts nitric oxide, which opens up your blood vessels to rush more oxygen and supplies to the injury. Second, it triggers something called angiogenesis, which is literally the growth of brand new blood vessels. Think of it like building new highways directly to the construction site. And finally, it gives the signal to your body's own repair cells, helping them get to the right spot and stay alive to do their job. It's actually a pretty elegant, multi-layered approach to healing.
So, the mechanism makes sense, the theory sounds great, but this is where the story takes a really sharp turn. We have to talk about the evidence, and specifically, the enormous gap between what we've seen in animal studies and what we actually know for sure in human beings.
And let's be really clear about this. In animal studies, the results are nothing short of astounding. We're talking about lab rats with severed tendons, torn muscles, crushed nerves, and BPC-157 has been shown to speed up their healing dramatically. This is where the whole Wolverine legend comes from. Honestly, if you're a rat, this stuff is basically a miracle.
But here's that gap I was talking about, and it is a canyon. On one side, you have this mountain of over 100 preclinical animal studies, and on the other side, you have this tiny little handful of human trials, and many of those are either really small or not very well designed.
And what about that Wolverine stack you see sold all over the internet? The one that combines BPC-157 with another peptide called TB500. Well, the number of published, peer-reviewed studies that have tested that specific combo in humans is a big, fat zero. It's completely theoretical.
And it gets even worse. As Dr. Tatum points out, even for the few human studies that were actually done, the detailed results were never published in a peer-reviewed journal. Let that sink in for a second. In the world of science, if your data isn't published, if it hasn't been torn apart and scrutinized by other experts, it basically doesn't exist. That is a massive, flashing red flag.
So this is the obvious question, right? If the animal results are that incredible, why isn't this an FDA-approved drug by now? Why hasn't some big pharmaceutical company thrown billions at it? Well, the answer isn't some grand conspiracy. It really just comes down to boring old patent law and economics.
See, here's the paradox. Because BPC-157 is just a fragment of a protein that our bodies already make, it's really, really hard to get a strong patent on it. And if you're a drug company and you can't get a patent, you're not going to spend hundreds of millions of dollars on human trials. Why? Because as soon as you prove it works, any competitor can just swoop in, copy the formula, and sell it for cheap. So BPC-157 is just stuck in this bizarre limbo.
In this vacuum, this legal and economic no man's land is exactly what created the Wild West we see today, a huge, thriving, and totally unregulated gray market. You see these products sold online, usually with a little label that says, not for human consumption, and they operate completely in the shadows with zero real oversight. And that means if you buy this stuff, you are taking a massive gamble. Because when independent labs actually test these gray market peptides, the stuff they find is, frankly, it's terrifying. We are talking about contaminants like lead and arsenic, bacterial toxins that can make you incredibly sick, vials that have the wrong chemical in them entirely, or purity levels so low that 95% of what's in the bottle is just, who knows, some random chemical byproduct. You literally have no idea what you are injecting into your body.
So let's put this all together. After wading through the incredible hype, the fascinating science, and the very real dangers, what's the bottom line? What's the final takeaway on BPC-157? It's really a tale of two columns. Over here in the promise column, you have this amazing body of animal data, a biological mechanism that absolutely makes sense, and tons of compelling personal stories. But then you look over at the proof column for humans, and it's practically empty. A few weak studies, zero data on the popular stacks, and a completely unregulated market with documented serious quality issues. The promise is incredible, but the proof is missing in action.
Which leaves us with one last big thought. The peptide genie is well and truly out of the bottle now. Millions of people are already using these compounds based on the promise alone. So, if the private market isn't ever going to fund the research, does that responsibility now fall to public institutions to finally get us some real answers? It might be the only way we ever find out if the Wolverine peptide is a genuine medical breakthrough or just a really cool myth that got stuck in a lab rat.